شام
خرما بوري تبيني زي خرما يصير عرام كيو بقول لك بس وصل
Okay.
Just give me a list.
It's fine.
Yeah? It's okay? Okay. So, ده بكرة بلغت نا تما صوب نيخو سبا ما
What sherbet
خطو sign takes probably his kidney. Yeah, and also his mouth gets really dry. His throat hurts sometimes. 50?
50?
Yeah.
Okay. How long has he been having the side pain?
The side pain سمرة وقت كيجي تا درد سمرة وقت كيجي 2 years.
2 years? Ah. Have him stick his tongue out.
هو بس ده It's still like dripping. الثقة وقت ولا كيجي الثقة وقت كيجي 4 years.
Mouth looks fine. Back looks fine. I don't think he has a kidney stone. It doesn't really sound like a kidney stone. One a day. This is some iron too. One a day.
That's like the bomb I said.
تش موجود أذكر كان في بعدين شيء طبعا إنسان بيكونه من أمريكا يبغى بكرة دواء
أمريكا
من أمريكا
دقیقا پرواز یواخه یواخه شام خه دقیقا پرواز یواخه خه That's okay. Yeah. پرواز یواخه
That'll work. Excellent.
In just a second. Open. Open. Say Okay. Ask him to cough twice, and then take some more deep breaths. Deep breath and cough.
And then he gives her you two are going to do a little high, 99 to very low.
She takes antibiotics. And taking care of themselves, or maybe educated?
Well, I hope they get a little more education. I hope it makes them less fearful of the Americans, that encourages them to come back for the next CMA, especially the women. I hope that this gives them basic medical care to get over. You know, some of the people we saw today were really sick in the last couple of days. Some people didn't know when they have asthma. They're supposed to take medication the rest of their life, and they're coming in, you know, not able to breathe very well. So we encourage them to continue to get this medication and follow up, you know, for medication for the rest of their life. And I hope that it just encourages them to follow up and take care of themselves.
What are some of the cases that you've seen before with them?
Okay, I saw a lot of asthma today. Some of the women were being wheelbarrowed in, you know, because they can't breathe. A lot of kids with ear pain, a lot of coughing, suspect a lot of tuberculosis. What else did we see? A lot of back pain, you know, very general complaints. Didn't see many cases of leishmaniasis, which we usually see, so haven't seen a lot this trip.
Okay.
Can't think of what else I saw.
Is communication hard?
Yes. Communication is very hard. You have to wait for the translator to try to get the information to you and vice versa.
How do they help the...
Oh, you have to have a translator to be able to do this.
Okay.
How does it help?
Like
I mean, usually when you're talking to a patient, you can, like, off the top of your head be able to say, you know, ask them questions, and like we're doing it back, you know, with the English-speaking patients. But here we have to, everything we say, we have to stop, pause, have the translator say it, and hopefully, you know, it's not as fluid. It's not as easy, but it's okay.
Okay.
It's better than nothing.
I have just one more question, and
okay.
It's just, can you kind of explain from the time that they come in until the time that they leave, what your process is as to figuring out what kind of medication they need and all that?
Well, I know when they come in the front, they're screened. I think most of the children especially are dewormed. And then they come through here, and they aren't, actually nothing is done until we see them. Sometimes Popke was actually screening some of them if she could take care of the minor problems. But until they come in here and we ask them what's going on, that's when they get the medication. But I know just worming medication was given out in the front.
Okay. How do you determine what medication to give them?
Based on their complaints, based on listening to them, finding out, you know, do they sound like they have bronchitis? Do they have, you know, an ear infection, draining ear? Everybody gets everyone gets vitamins. Everyone gets ibuprofen, Tylenol, aches and pains. And if they sound infected or they have high fever, I'll give them antibiotics. One of the limitations is we don't know if they have malaria. We don't have any tests right now to be able to test for malaria, which would be nice. If we could do rapid tests, then we could see if that's what's causing the fever. But a lot of them complain that they have malaria, and we can't test for it.
There's nothing? I
treated a couple just based on what they said to me, based on, you know, their fevers come and go every few nights. So I treated a couple adults with the medication. But to do good medicine, we should have the little test to quantify it.
I thought I saw Colonel Jones give, actually I don't even know who it was, give like a referral to a local hospital. Can you do that too?
We could do that. We could give them a referral. They could come back here, which would be almost every patient we saw, though, because they all tell us they have fevers. But Jeremy here can look at it under a microscope. He doesn't have the rapid test, but he has the microscope so he can look for the parasite under the blood. You know, under the microscope, you just take a little blood, smear it on a slide, and look at it under the microscope. You can see if the parasite's present or not. Cool. Same with tuberculosis too. He will treat for tuberculosis here at the clinic.
Oh, okay. All right. Well,
all right.
Do you have anything else?
That's all I've got. Thanks.
Okay. Why do you think it's important to have these medical clinics?
The medical clinic? Oh, well, the people are very, you know, there's a lot of sick cases out here as far as illnesses. A lot of them we can't treat just because we have minimal care that we treat. We try to get the ones that, you know, can be treated here. If we can treat them at other places as far as referrals to the Egyptian hospital, to, you know, to other local area clinics that have been actually upped with medical supplies and equipment from the United States, that's good. They can get ultrasounds. They can be referred to other places. Sometimes you can't help the people. They're already in later stages. So you just try to comfort them, you know, sit and talk with them. Sometimes people just come just, they want to talk. They want to talk and have attention and just someone knowing that they care about them.
Who comes to these?
You have people coming from miles away. They'll walk like from the crack of dawn just to get here. You have all the locals in the area that come, and the SF will put it out, or whoever's the PRT commanders, they'll put it out, you know, at a certain point in time and say, hey, there's going to be a clinic here, and they come out, and you have people from all the villages that just come to get treated.
What do you hope that this can accomplish?
I hope that it can bring peace a little bit more than it is. I hope that it brings safety, more or less, to the troops here. It brings rapport to the area, knowing that we're not the bad guys, we're here to help them. We're not here to hurt them, and we want to establish that, you know, that line, and, you know, to say, hey, we're here to help, we're not here to hurt you, you know, we're your friend, you know, don't be scared of us.
How often do you have these?
We try to do them at least twice a month, depending on the circumstance. Other times we've gotten up and gone within 12 hours if there's situations that need to be tended to, as far as emergency relief missions from the rain, the drought, illnesses over the winter time. There was massive outbreaks of, you know, whooping cough. The flu season was pretty bad here this year. The winter was harsh. So it all depends on the area and what, you know, what's going on in that specific region.
Okay. There's one thing I just noticed. Okay, let's see. What are some of the cases that you've seen before with them?
We've seen cases of leishmaniasis. We've seen malaria. We've seen just simple, basic, you know, infections. You know, like a simple abrasion can turn into a massive infection that leads into the joint, where you treat it with antibiotics. Hopefully you get it soon enough. But even the smallest things in our country that wouldn't even faze us, if you just cut yourself, you just, you know, put a Band-Aid on it. But here, you know, with the dirt and the dust, I mean, it can turn into, you know, something, you know, far more that needs to be treated with antibiotics. So,
is communication hard?
It's difficult. The interpreters make it easy. You sometimes feel a little powerless when you can't understand what they're saying, but the interpreters really do a really good job as far as, you know, helping us out, as far as trying to break that communication barrier between ourselves and treating the patient.
Can you explain what it is that you do for them from the time that they come up to you and till the time that you give them their medication? What is it that, what's the process that you have to go through?
Basically, you know, they'll come in, we'll sit down and talk with them, you know, see how they are for the day. Hi, how are you? And, you know, generally they'll go straight to their chief complaints, and, you know, we'll either triage them in the front here to see exactly what needs to happen, if they need to see the PA, if the medic can just simply give them something that's, you know, put out in a, like an algorithm, Motrin, that type of thing. But there's some things that need to be passed on then to the PA just for diagnosis and to see if there's a further referral that needs to happen to the other area hospitals here.
Okay. And my last question is, do you know, if you don't know, it's okay, about how many you see, like, a day?
We see anywhere from 200 to 1,200 a day. It depends on the region. Some regions don't allow their women to come out. They have a very strict, you know, they're just very strict in their ways. They don't let the women come out. And sometimes the men will come out and get the medicine or try to obtain the medicine for their wives. But it depends on the region. Some regions you have, you know, every woman in the village will come out and be seen. Others you won't see one woman for the entire day. It just all depends on the area and how strict they are with their women, with the women, their wives, their children.